There is a quiet fear that many of us carry as we get older. It's not just the fear of illness, it's the fear of losing our independence, the fear of relying on others, the fear of becoming a burden to the people we love. And sometimes, an unexpected health event doesn't just test our bodies, it exposes the fragility of our financial plans and our peace of mind, just like my patient, Mr. Mary. Hello. I am Dr. Mariz, and welcome to the Modern Senior. We often think that once we have Medicare, all major medical costs are taken care of, especially Medicare Part A, our hospital insurance. But that net has holes that many people only discover when it's too late. Mr. Mary's story is a painful lesson about that and about the deep-seated fear I just mentioned. Mr. Mary, 75, a man who always prided himself on his independence, had an unfortunate fall and needed hip replacement surgery. He knew his Medicare Part A would cover his days in the hospital, and it did. His 5-day hospital stay was well covered, but that was only the beginning. His doctor said he needed at least 2 months of intensive rehabilitative care at a skilled nursing facility. That's when the shock hit. It wasn't the shock of physical pain, but the shock of realizing Medicare Part A would only cover a small fraction of this type of care. The rest of the enormous bill, tens of thousands of dollars, was left for his family to figure out. What hurt him the most, he confessed to me, wasn't the money. It was the feeling of helplessness, the feeling that he was now a burden to his children. "I worked my whole life so I wouldn't have to bother anyone, doctor," he said. Mr. Mary's story shows that Part A, while crucial, isn't everything. It's like the strong foundation for your healthcare house, taking care of acute storms like a hospital stay. But it is not the walls or the roof that protect you from the long, steady rain of long-term care. Medicare, by its original design, does not pay for long-term custodial care at home or in a nursing home. The fear of becoming a burden is real, but facing it means planning with realism. Talk to your family about your wishes. Learn about long-term care insurance or state-specific programs like Medicaid. Create a clear financial plan. Preparing in advance protects your finances, your dignity, and your peace of mind. Health is also peace of mind. Understanding the limits of Medicare Part A is the first step toward building a more comprehensive plan. Don't let fear paralyze you. Let it be the motivation to act today.